Hi, good morning. I was asked many times about my positive personal experience of helping a patient with acute myelogenous leukemia to get a remission. Of course, the treatment was a traditional treatment, modified according to her age and to her condition, and natural treatment. In my case, I was helping in the natural treatment. So the natural treatment is healthy lifestyle. She was admitted to the hospital, continuous care, and we cannot do without the traditional classical treatment, but it was modified. So the natural treatment, it was really the ventilation of the room, sunrise and sunset, to follow the biological clock. She did eat breakfast at about 9, and last meal is about 3 p.m. She washed her teeth. The patient was 79 years old with Parkinson's disease. She is 170 centimeter in height, but the weight was only 45 kilogram. The main thing in the natural treatment was also water, hydration, clean water, and also exercises, moving in the room. Also weight exercising, using her body weight to get up out of the bed to keep the muscle, because she was frail, and I wanted to help her to get muscle strength. Massage, and also exposure to infrared light, the lamp, which is 850 to 1300 nanometer, 15 minutes every day, to the legs, to the abdomen, to the back, to the chest. Of course, the panel of infrared light, which I brought with me from London, it was 650 to 850, but it was heavy, and the frame was metal, so I left it in the house or in the flat. So the natural treatment is she drink green tea, ginger, which 1 glass every day, and she takes supplement, which is vitamin D3, K2, magnesium, B complex, L-carnitine. Some nuts, which is about 2 walnuts, 1 Brazilian nuts, the green leafy vegetables salad, which is about 9 cups. I add to it 1 tablespoon organic extra virgin olive oil, cold press, and 1 tablespoon apple cider vinegar, which is made at home, which is organic. The vegetables are rainbow in color, and it is steamed. But the main thing which I want to insist is, when she started to develop cough, she could not tolerate the natural medicine like eucalyptus, menthol. So the best thing she responds to it is saline with oxygen, which is in the bed. The oxygen mask is fixed in the bed. So this is the food. But the main thing is not the food, is the fasting. During the first cycle of chemotherapy, it was water fasting. 2 days before the cycle, water fasting. If she felt hungry, then she chew organic white cabbage, which is cooked. Water fasting. And then the very important, and it lasted for about a week. Why water fasting? Because according to the book from the professor Thomas Seyfried, cancer is a metabolic disease, and he did experiment for 30 years on animal and dog tumors, not on human. And he found that the cancer cell live on glucose fermentation. So if we stop sugar and refined carbohydrate and even all food fasting, the cancer cells will get weaker because there is no energy to live. But also he found also the glutamine amino acid is also used by cancer cells. Of course, this is not new. His ideas and research depend on a German scientist, biologist, Otto Warburg. Otto, O-T-T-O, Warburg, W-A-R-B-E-R-G. He's a German. He found that cancer cells, they don't need oxygen to live. How? Because he did experiment in his lab by giving arsenic to an animal with a tumor, and the animal died. But the cancer cells continue to live. And this is how he find out that glucose fermentation is the way the cancer cell live. But Thomas Seyfried, he found now recently, it is also in addition to the glucose is the glutamine amino acid. And this is very important, the basis of my treatment and health. But the traditional treatment is very essential. We cannot do without it because it is the investigation, the MRI, the scans, the bone biopsy, the histology, histopathology, a blood test every day. And a blood test every morning to check the blood sugar. We achieve 3.5 millimole once, but usually the blood sugar was 70 milligram per deciliter to 80 milligram per deciliter. The traditional treatment was, according to her age, weight, it was 1/8 of the dose. For example, the usual dose is given for a patient who is younger and with muscle. It was 400 milligram, but what she received is only 50 milligram tablets. And she take it in the morning with water. Also, they did many blood tests, especially the viral panel. And she has many viruses which are dormant. So to prevent the activation of these viruses, they gave her antiviral treatment, continuous. Also antifungal treatment. When I asked why antifungal, she has no fungus, they said because it will potentiate the action of the chemotherapy in the liver, because she is receiving a small dose, 1/8 of the usual dose. Also, she receives subcutaneous injections. I don't mention the name of the drugs because this is guideline by the hospital and she did it. So it's chemotherapy cycle, tablets and injection, then antifungal therapy and antiviral therapy, which continued. Of course, the cycle was repeated many times according to their guideline. The room was almost sterile when I go in, or the doctors or the nurse, we put mask on the nose, wash the hands and the gloves and apron, just like I'm going to the operating theater, because during chemotherapy, the immune system get depressed and the neutrophil, the white blood cell, get very low. And this blood test is done every day to check the white blood cell, hemoglobin, and CRP, which is C-reactive protein, which indicate the infection or the tumor or the reaction of the body with the dead cells. It indicates a general idea. And it shot up to 360. Ideally, it should be less than 1. And the management was they gave her blood transfusion, 250 ml, intravenously every time the hemoglobin is less than 80 grams. The hospital was very high standard. The care was excellent, and it is free on the government. This is how medicine should be. Then biopsy to check the results, and she received many courses of chemotherapy. So traditional therapy is essential for treatment of cancer, but natural treatment is also important, which is the food, the exercise, the sleep, biological clock, and the supplements. It was hard work, but it is worth it. I wish you subscribe to my channel. Thank you and goodbye.